Hello everybody, my name is Lorcan Brennan and it's my great pleasure to welcome you to this workshop here for marking and celebrating MDN at 25 years. I've been working here in the MDN for probably a good number of those years, and my present position is in training and resource development as a manager there. It's been a great privilege. I was thinking about this yesterday when I was writing a few notes for this morning. And it's been my great privilege over the last number of years to really share the company of many people, especially in my working life, who have been both generous and creative and intelligent and committed in the work that we've been about in relation to men's health and men's lives. And today, just to be here, when we sat down as an organization, we started to reflect on the idea of what way we'd like to celebrate and mark 25 years in the work. There was a couple of things that came to the surface very, very clearly. The very first thing that came up was that we said we'd like to mark it in a really reflective and a conversational way. And so for the next while, we're going to do that in a conversational, reflective way with the two lovely people we have here on the screen with us. The second thing that came to the surface I thought was really interesting as well for all of us was we said we wanted to celebrate the years through partnering and alliances, because a really important part of what we've been involved in the Men's Development Network has only been about literally working through the lenses of those strengths that came from partnering and alliances. And Biddy and Paula, who are here on the screen with me today, represent key partnerships that have been very, very much part of our lives in the Men's Development Network, not just organizationally, I call you colleagues, folks, but also to have the friendship and the learning that's been part of being in your company over the years. So it's absolutely lovely that you're here with me for the workshop today. And the workshop is called Championing Men's Health from a Women's Perspective. And both Biddy and Paula have contributed hugely on the island of Ireland in many different ways in relation to, I suppose, making men's health and men's well-being and men's lives very visible in lots of different ways. And in the conversation we're going to have, and in some of the slides you've brought along, I know you're going to explore and explain that to us from your own perspective, professionally, and also as two really fantastic women involved in championing men's health. Look, I was looking and I was saying it to both of you there before we started. Both of you have really long CVs. Maybe you can say a little bit about that through the workshop as we go. But just to say that Biddy is the National Project Lead in Healthy Ireland with the Department of Health. Her areas of responsibility include healthy workplaces, mental health promotion and mental health. She has worked in health promotion for over 25 years at both strategic and operational level within the Health Service Executive and the Department of Health. And she's a background in nursing and addiction and counselling and holds an MA in health promotion. I could keep going, Biddy, but you can tell us a bit more.
Fine.
There. And Paula, you've been there as well for a long time working in the background, course leader and masters in advanced facilitation skills for health and well-being at the Southeast Technological University. You've also lectured on undergraduate and postgraduate programs within the department and have done so since 2003. You've been a health promotion specialist. You've linked to so much, Paul. I'm not even going to go through all of this because I want you to tell me as we go through the workshop some of the key pieces of work that are linked to your CV here as well. But it's really, really lovely that you're here. And I know you're going to lead out on the workshop in a moment. But just even before we go there, because it's kind of coming towards the end of the week, we've had a long 25 years. I'd love Biddy maybe to begin by telling me, Biddy, the why and the how. Where did it start and how did it start for you in relation to being here on a workshop championing men's health from 25 years ago?
Thank you very much, Lorcan, and it's great to be here, and I'm delighted to be part of the MDN. Work closely with them for the last number of years. We've been involved in men's health, so they've certainly been a great partner in that. So well done on your 25 years. So in reflecting on this, I suppose initially I'm very clear that I grew up in a house where there was definitely a sense that it was the women's responsibility to look after men in every sense of the word, from their food, their nourishment, to their upkeep, to their well-being, everything. So that was very much a piece of my conditioning that I grew up with. And I suppose that was always one of the challenges in the outset, was that I always felt that women need to give back responsibility to men at some level, because so many of us were brought up feeling we had to be responsible for them. So that was from my own personal experience. But then for me, and in talking to Paula about this, there was a light bulb moment in 1999, which is kind of 23 years ago at this stage, when we had a seminar. There used to be Cancer Week, the Irish Cancer Society used to have Cancer Week, and we had a different theme every year. And one year we did a seminar on men and cancer in the Southeast. And Ian Banks, who's one of the leading specialists in the whole area of men's health, came and presented. And I remember just being so struck with the evidence he presented around the morbidity and mortality of men and cancer. It just literally resonated with me and landed, as I would say. And so subsequently then, the year later, the national strategy identified the need for the development of a men's health policy. So it was now at a strategic level, and we had some information. So I suppose I chased it around. That's the only way to describe it. I chased it around looking for an opportunity to get this work going. And then after quite a while, we got some funding from the department to do some research to inform the strategy. And that was where it all started. So then we got that funding, and getting inside men's health, or the research, I can't remember what the research was called.
Getting inside men's health.
Getting inside men's health. So Noel would have led out on that research. So we found Noel, and then we found Paula, and it took off from there. But it was very much, it was very much that light bulb moment. Like there was women's health officers in the old health board at the time. There was a focus on women's health, and men's health was not even on the radar. So it's something, as I said, landed in me, and I had a great urge to do something and to follow through and to make something happen for men. And I think as well, just very quickly, I had worked in addiction for quite a number of years, so I really was aware of the vulnerability of men behind that masculinity and behind addiction. And I always found when you did get to engage with them, they were so open and so willing to look at themselves and to change. So I suppose that influenced me as well a little bit.
And since then, you've been really right up the middle of the pitch, Biddy, in so many different ways in relation to strategy and policy and promotion. So it's really super you're here today. And you gave a lovely introduction to Paula, because you said, then we found Noel and we found Paula. Yeah. So Paula, tell me how you were found, and did you feel found?
Yeah, I'm smiling. It's been really nice kind of reflecting on this in preparation for today, because, like, unlike Biddy, I grew up in a household of women. I'm one of 5 girls. There was 6 women in the house, and my dad, who would have, done very long hours outside of the home. So I felt it was very much a female environment that I grew up in. And when I finished college, I just nearly accidentally found myself in the HSE, or the then Southeastern Health Board, in a physical activity role that was coming to an end. And Biddy and Noel were there at that stage, and asked me if I would come and help with policy. And I remember coming home to my now husband going, I know nothing about men's health, and I know absolutely nothing about policy. And so, what do I do next? But so I actually started reading the drafts of Noel's research, Getting Inside Men's Health. And I suppose a little bit like Biddy, the evidence was overwhelming. He did a lovely study that combined qualitative and quantitative research. So, there was all the stats, and I would have come, from my own PhD from quite a quantitative background. So I could wrap my head around those, and even, dug into them a little bit deeper, actually, and kind of gave a bit of feedback to Noel on that, because I was really shocked by some of these statistics, across all age groups and all of the leading causes of death. Men were more likely to die, and in some cases up to 4- and 5-fold, depending on the cause. And then I suppose what was really interesting was kind of unpacking the stories that Noel had researched, and learning about the factors underpinning those stats, and really putting meaning on to how those outcomes come about, which was really, really mind-blowing. Because I suppose, unlike Biddy, I wasn't really aware. I was a 26-year-old young woman who really had limited life experience at that stage. So I wasn't really aware of the vulnerability of men and what might be causing those particular outcomes. So I was kind of hooked. I remember becoming passionate quite quickly, going, this isn't okay. And I think soon after Noel's report, the Institute of Public Health also published a report, and they called it a fundamental inequality in health. And I just thought, if this was happening to another population, subpopulation within this culture, there would be more happening. Like Joe Duffy would be jumping up and down, but nothing was happening. So for me, that silence was pretty maddening. So I found myself going into spaces for many years, being asked why I was there and why, as a woman, I was talking about men's health. And so I found the lack of awareness of the evidence was huge, and the lack of any kind of energy to do anything about it. So, you know, we were a good 4 years developing that policy and trying to get it over the line. And, you know, I met a huge amount of people throughout the island of Ireland, or certainly the Republic, who were passionate and trying to affect change, but struggling to do that. So I suppose a key turning point that I would have seen, where I stopped getting asked why I was working in this area, was actually the last recession in 2008. I think, you know, there was such a need at the coalface of services for men. I think it became obvious that men were being hit really hard by that recession, that more support started to come. And I suppose just the last little icon there is about something why I've always stayed. And it is about that community of people who work in this area. You know, there's a huge kind of advocacy piece. We are small in numbers, but, you know, collectively, we do so much more than the individuals that we are as we work together as a team, which I really enjoy, despite the frustrations.
Yeah. And that's the great thing about why we're here today, I suppose, celebrating being greater than the sum of the parts. And that's a super introduction to people who are here with us today. It's great this is being recorded, because, I mean, that's a real story in itself, sociological history of your involvement along the way. But what I'm going to do now, respectfully, is I'm going to mute myself and I'm going to turn off my camera even, because I want you to talk to us as a group that have arrived here. And we will have a little bit of time for Q&A maybe afterwards. We want to keep an eye on the time as well, because this could grow into a real festive conversation. So we'll just keep an eye on that as well. But look, I'm going to let you off, Paul, because I know you have a few slides just to bring us more into the specifics of that journey for yourself and Biddy. And thanks for being here with us.
Thanks, Lorcan. So yeah, I was really enthralled by what Michael Flood had to say around social conditioning and gender. I mean, it absolutely really set you all up very nicely for the piece that I'm going to do here. You know, we are social beings, we're relational beings. So I suppose in terms of why women have a role in men's health, you know, Biddy and I are going to maybe speak to two particular areas, and this is my one. You know, we are a relational species, and what happens to men affects us too. You know, Biddy spoke of being grown up, you know, her social conditioning about her experience in her own home place. But I have despite the fact that I said my own home place is quite a feminine environment, there were very key messages that I know I got in that space, in terms of looking at how my mother and father related to each other. And, you know, one of the things I was really aware of is that men got fed first at our table. You know, we did all of the domestic duties, and it's something that we have, with a lot of fun, have actually challenged my mum about as we've brought home our prospective husbands. And they all have this thing that, you know, they got put in at the back of the table where they couldn't even move to get out to help, you know, if it was children or if it was anything. So it was something that was very strong in our house, because we do learn how to be who we are in the environments that we grow up in. You know, our homes, the institutions that we're in, our communities, where we play, where we pray. And culture is really huge in how we become who we are. And I suppose, as you know, Michael Flood alluded to, how we condition within our society does impact the decisions that we take on a variety of levels, you know, what job we're going to do. And I go to my students actually as I'm introducing this concept of gender, you know, because I don't think we fully realize how it impacts nearly every single decision we take in a day. You know, it impacts how we, you know, what cologne we put on, it impacts what clothes we wear, it impacts what food we eat. When we're out for a drink with our friends, it impacts our choice of food, drink, the profession that we do. It's really a massive influencer on the decisions that we take and the behaviors that we engage in. And so many of these are related to our health. Michael Flood spoke of, you know, masculinity and the men who adhere to, and it's not just men actually, women can do this too, but men who adhere to more traditional masculine beliefs are more inclined to engage in riskier health behaviors. And they've been socially conditioned to do so. And I suppose I just want to be clear that we now, certainly from when I started this work about 20 years ago, I believe we live in a much more richer and gender inclusive society, which I think is wonderful. But it's still beneficial to unpack one particular aspect of gender, which is masculinity. And as others have said today, there isn't one way to be masculine. There are multiple masculinities. And I think I always like to also remember about gender is that, you know, it's temporal, it changes over time. It's quite a dynamic construct. How to be a woman, for example, in Ireland today is quite different to how to be, you know, what the social norms dictated, you know, 50 and 60 years ago. And the same is true for men, but maybe not to the same degree. I think, again, as I mentioned, culturally, it's really relevant, you know. Up until relatively recently, I think, you know, the Catholic Church had a huge influence on how we were to be male and female in this country and what the social norms dictated that were different to other countries. So I suppose I say that because I kind of get a little bit excited that, you know, gender is not fixed, and we're talking about new conversations for men. And you know, we are adaptive human beings, and evidence is there that we can continue to change. And I mean, in Michael Flood's presentation there, he talked about how young men in Australia, their attitudes are changing, which I think is wonderful because it does present a hope that, you know, the current issues that men are living with don't always have to be this way. But I suppose a couple of things that I'd like to draw your attention to about the social conditioning that particularly affect men's health, and we've done a bit of research on this in Ireland, is around, you know, their help-seeking behaviours. You know, men are particularly slow, and I'm going to go to my notes here if you don't mind, to seek help for particular health issues such as physical disabilities, mental or emotional health, and sexual concerns. And this isn't always driven by, you know, the association between seeking help and weakness. I think what's really important for anyone working with men is to understand that they very often have very poor symptom recognition. We tend not to teach men and boys about health in the way that we teach and educate girls and women about their health. So there can be a general lack of awareness among men about their health that, you know, stems from education, a lack of engagement and utilization of health information, and then they tend to trivialize their symptoms. And the delayed help seeking is really relevant to men's health. And you couple this with those more masculine beliefs, or those men who in particular are aligned to more traditional masculine beliefs, it can really impact whether they recognize or even acknowledge the symptoms that they have with respect to their health, and how they might appraise those and seek help. So it's particularly relevant. And I suppose in that context, I think if you consider the society that we're in, we have you know, a fairly significant proportion of our society who may adhere on some level to these beliefs, and yet across our local and national governments, these are the individuals who predominantly make decisions that affect all of our lives. one of the things we would have repeatedly said at the outset of the policy is that despite the positions of power that men hold in society, they are conspicuously absent in health policy and other policies that affect their health. So I think this is really important to have a look at, that this imbalance at a decision-making level really matters. And while personally I wouldn't have been a huge fan of the gender quota legislation, I can really see its relevance at tipping this really significant imbalance, and why it's so important that other voices are heard in those rooms to support those men to consider the health implications of the policies that they're making. So the next few slides, I'm just looking across a few aspects of our society where this is relevant. So if we look at the civil service, I think, again, this is quite interesting. If you look at the bottom line here, effectively, there's 63% of those employed in our civil service are women. However, they're grossly underrepresented at the most senior grades where key policy and operational decisions are taken. So again, if you look up here at the general and the assistant secretaries, etc., they're predominantly men who hold these positions. If we go to industry, we'll have seen this before. This is probably more widely marketed or publicized. But again, across industry, if we look at those who are CEOs of companies and those who are chief financial officers, while there have been slight improvements from 2019 to 2021, again, these are predominantly male positions where decision-making and policy is made. So these are particular examples that I have given you here. However, I would encourage you all to consider your own lives, to consider your own communities, and see where power lies with decision-making across all of these sectors, because gender, as I said, even on an unconscious level, infiltrates so many aspects of our lives, and in so many really important places, you know, things like our legislature, our Supreme Court. Look what's happening in the States and how powerful a Supreme Court can be. As I said, even today, the Catholic Church is, you know, still holds an awful lot of power in this country. Look at our communities, even look at our homes. Look at the policies that are, when I started in this work, there was no paid paternity leave for fathers. Now it exists, which is absolutely fabulous, but it is still a fraction of what women get for maternity leave. And it has a significant influence then on the roles we adopt in our homes. And again, I know this from a personal level with 3 small kids here, that when you are spending so much time at home, when it's more socially acceptable for the woman to take the unpaid parental leave, we do tend to adopt particular roles in our house, which do influence the health of everyone in that home. So, yeah, I'm going to finish here and hand you over to Biddy, but just to say that I think for all of us as human beings, it's really relevant that we do consider the role that gender plays in our own lives. And then I suppose I've seen with my students so many times that the blinkers kind of come off. And I know what happened for me. I call it my light bulb moment, where the blinkers really came off and I could see, wow, this is such a powerful aspect of being a human being that there really isn't enough awareness about, because it has such a huge effect on all of our health. And I do think in particular, it's impacting men's health hugely. So Biddy, I will pass you over to the second aspect.
Thanks, Paula. And I suppose in this one, and I think you reminded me there as well, Paula, I know I was involved with the schools many years ago, and again, predominantly female teachers, but where there were males, they were predominantly principals or vice principals. So that's there's equally strong evidence there, and it probably has shifted a little bit, but it was very, very evident. But again, I suppose taking us back to women in health and social care, again, the same applies, that women form 70% of workers in health and social care. And again, they're looking at 53% of physicians are female, all of the regions have more, but 84% of nurses are female. So women, so it's, in the slide there, we're saying men's health is women's work. And that's the caring, that's the drive, I suppose, of the caring role again, that was probably predominantly infiltrated women, young women, when they were growing up. My initial work was a nurse, and again, it was that need to look after people, and it was the drive that was in all of us. So again, very strong evidence there. And I suppose one of the things over the years we've looked at then is how everybody working with men interact with men, and do we bring our conditioning, or are we aware of the different elements of that? So then looking at the health service personnel by grade again, strong men at certain levels within this, but then again, predominantly support and care staff are predominantly women, and management and administration probably has improved there in terms of women's involvement. But nursing would stand out, I suppose, within that graph there in terms of how many women. And while I think there are more males joining nursing, they are still very much a minority in any cohort, in any group. If we move then to the voluntary sector, and I suppose this has been the gender pay gap has been a discussion that has been heard on the airwaves over the years, for the last number of years. But again, that there is a significant, there's issues in relation to the gender imbalance at the highest levels. Twice as many women work in the sector as men, but men are overrepresented. But there's also a pay gap, which has been a strong issue of debate. And I think very much in private sector as well. I know in a lot of the private organisations, there's an ongoing debate about that men are paid more than women doing the same work. And I suppose the other point here then is around, and Paula mentioned this earlier, is around how recession disproportionately affects men's health. And I suppose that was clearly evident from our first recession. And in a way, you mentioned it earlier, Paula, the timing was, if a recession is never time good, but it did give us some levers in terms of addressing men's health. It brought attention to it, particularly around mental health, I think, at the time, and suicide rates and all of that. So I think there was an acknowledgement that, yeah, men's health needs to be looked at and men's health needs to be focused on. So that was one of the elements of it. And again, I suppose the impact of recession, again, can predominantly be felt by women working in communities and addressing these issues. So there's lots of imbalance in there, and there's lots of areas for work, and I think there's lots of challenges for us in addressing all of these.
Lorcan, are you going to come back into us there?
Of course I'm coming back into you, if I can come back on camera there. And that was really, I was just thinking from the introduction that I gave both of you, saying, like, what was it, why did you start? And I'm just thinking, I'm so glad you stayed. Some of those slides, I mean, there's so much work still to be done when you look down across the inequalities that are still so visible and yet so hidden, but represented here today. And that's why I say, just to have you on here today and to be part of the Men's Development Network's marking 25 years, and to see that energy and that clarity that you bring to everything that you do is here with us today is really, really important for me as well. What I would like to ask you then, because there is a lot of work still to be done, and I know that, in your commitment, your CV, when we started with it, you've been very specifically involved in key pieces of work. But when you look at even those slides that you've brought to us today and you see the inequalities that still exist, I suppose the question is, who are the sectors now, or what are the sectors, especially even in relation to your championing of men, that we need to focus on? What does it look like even for yourselves in your relation to your own commitment? Where do you see your own work as we would go into the future? I suppose, where do you see yourself in that? When you look at this, say, well, what's the response to those slides and that story you've just told us here today?
Do you mind if I hop in there?
No, please.
Because there's something with me. I absolutely accept the inequality is there, and I do see that, and that's a relevant piece of work to be looked at. But I think today my greater focus is on the fact that in all of these positions, that have, I suppose, the power to affect change in terms of policy and legislation, we have a group of men who predominantly hold these positions. So I think the work is there, actually. You know, if you consider the social conditioning that these men have lived within this country, you know, it affects the decisions and policies that they then make. So I'd actually like to link this to what Michael Flood was talking about, is that we need to go much bigger. You know, the programs that we're doing are very frontline, and they're very good, don't get me wrong. But I have a real energy, and I don't know how to possibly get the in to get into large organizations at middle and senior management level, get in, you know, and start to affect change at that level. I know, for example, Brené Brown has managed to do this with her Daring to Lead kind of programs, but she doesn't go in and work with, you know, the frontline staff. She only wants to meet the CEOs and actually change the culture around the boardroom, because that will filter down. And as I said, I haven't got the answer as I'm sitting here as to the how of that, but I really do know that that's so important, because the decisions that those men, and they are predominantly men, you know, there might be the token woman here and there, but those decisions and the culture they create in a workplace will affect everybody. And I actually think that, you know, that type of intervention could travel quite far, because we have a school system that educates people to get into a workplace. The universities are doing the same. So, you know, we're always asking the question, you know, what does the market want? And if the market wants, you know, more inclusive, sensitive, health-focused workplaces that care about the individuals there as opposed to the outcome solely, then I do think that kind of work would kind of have tentacles that would reach out into other areas over time.
And Biddy, I suppose that, just to come to yourself, because I mean, like Paula is saying, even in the context of, it's nearly a no-brainer in the sense that a healthy workforce, for example, is a productive workforce as well. You know, we know that about, and I know with your own work in relation to the workplace, you know, there's real possibilities in the future, your own championing work.
Yeah.
Where do you see it going?
Yeah, no, and I suppose one of the things that came up very strongly through all of our consultations in relation to the healthy workplace and to the research was culture change and how important culture change is. And I think all the evidence points us as well towards that what people value in workplaces, whether they're male or female, is how they're treated, how they're valued, how they're respected. And that culture is really important, but it's also probably one of the difficult ones to change. I do think there is more awareness around culture in workplaces, and I do think we are seeing some more examples, because workplaces are being challenged in terms of retention and recruitment, and, you know, younger people coming into work, like if they don't feel valued and respected, they don't stay. You know, I think that has shifted, and I think it's causing pressure for workplace. But I think, you know, sitting here and reflecting on over 20 years work, I mean, I suppose I still see there is so much work to be done. Like, I think we've only tipped the iceberg, and the reality is there was only ever a small group of us with a very small budget trying to do an enormous amount of change. But I think we have created some great foundations, and I think there is a real need to continue. I think it has to continue from a strategic perspective. There has to be a value and a recognition that this is important on the agenda. And then it has to continue at all the different levels. So, you know, our partnerships, we have to continue to grow them, our networking, our research, our evidence, our community groups, we need to continue to work. And, you know, I would have always said, Larkin, that's been one of our major strengths over the last 20 years, is how we have worked together and our resources, how they have dovetailed and supported us. And I think they've kept men's health on the agenda, because it has all been, the research has been really strong around it. But like, I don't underestimate the challenges ahead, but I think we have done some really good work that we can say is there, and we can build on it. But there's still an awful lot, you know, and you're looking at the equalities across kind of the workforce there. If we go down to some of the groups, then the more focused groups underneath, the inequalities get even greater. So if you think about travellers' health, other marginalised group, the inequalities get even bigger in relation to men and that. So we have a huge amount of work to do. And I suppose, even though we've had SPHE and we've had health promotion and all that in schools for many years, it just has, I always feel it's never been embedded enough to be creating a generation of younger people who are able to challenge those kind of the roles and the gendering and the masculinity. So I think we've a long way to go, but I think we have a good foundation.
And we have the possibility, we're looking at new curriculums and we're looking at loads of new initiatives, which is good as well. And there is a lot more linked up thinking, I think, going forward. Paula, can I ask you, I'm just conscious of time, folks, about 8 minutes left. And if anybody there, our participants, have a question, or don't be shy, as I say, you're in your grannies, you might want to ask these two fantastic people a question before an observation, whatever, before we leave. Please come on and say hello to us. But I was going to ask you, Paula, when you think back then, and Biddy will ask as well, what you've mentioned pieces of what stays with you, as it is a day where we're marking maybe some of the ground that has been claimed. What stays with you as the achievements that you feel when you look back as even legacy, and we're only halfway through legacy, we hope. But what stays with you, Paul, around the things? I was so glad I was involved in these pieces of work specifically.
Yeah, I've actually got a couple of them, I think, named here, if it'll move on, but even if it doesn't. I suppose for me, I think having a policy is absolutely critical, actually. And I suppose, as I said at the very outset, I didn't know much about policy or anything about policy when I started. But it's really, really important to have a clear mandate that's been signed off at a government level, that this piece of work has to happen. It legitimizes you being in a room, legitimizes you seeking funding for pieces of work, and it does hold a respect at that level, which is very important. I know that colleagues in the UK and elsewhere didn't have a policy. They had an equality legislation, and it just didn't pack the same punch.
Yeah.
And I know other jurisdictions have since been trying to get a policy, and I wouldn't have appreciated the value of having that. As I said at the early stage, it was great to have it renewed then in 2016. It's up for review again. And I would really hope that we continue to have an action plan for men's health, and that there isn't a gap, and that kind of advocacy at that level can keep happening, because it's really critical for the rest of us who want to do any kind of work in this area. The other two bits that I'd mention that I think are really important are the Engaged National Men's Health Training Programme. Upskilling people to actually work with men is really important. Like Biddy has spoken about, there really are so few of us, over the last 20 years. The pool of us hasn't grown massively in terms of those of us who are kind of spearheading this. But actually, what I've observed through the Engaged program is that more people are now advocating for men's health in different organizations, because they've got a much greater appreciation of the need for this work and how to do it, which is really important. So for me, that training program is really kind of like a beacon of light in this work, and should keep going. And I suppose the third bit, and I'm obviously very passionate about research, so there might be a little bit of bias here, but I think continuing to educate ourselves on best practice and what works, and underpinning all we do with evidence, evaluating all the work we do to a very high standard, should just be embedded in our practice as we go forward. Because, relative to women's health, and, we are still in an infancy in terms of, how to engage different groups of men, what works, what doesn't work. As Biddy said there, we haven't really even touched upon a culture in workplaces that are predominantly driven by men. And I would say in other places, schools, the principals are the people driving the agendas in schools, predominantly male. We were struggling to get SPHE embedded. So, yeah, I think that we need to continue to be innovative in what we do, try to venture into these fields of work and evaluate what we do and keep writing it up so that we learn how to do it better and can bring others along with us.
Very good. And Biddy, just to add to Paul, I'm sure some of them are the same with the workplaces.
They're very much the same. I suppose, like, I think to continue, like, some of the principles that have got us to where we are today is that we worked very much in partnership, and we looked at who can we bring around the table that is an advocate for this area, that is passionate. And I suppose, I think one of the things, and I've said this before, one of our successes has been the fact that we have had the voluntary, the statutory, the academic, all working together over the last 20 years. So really, that engagement, I think, was critical to pitch us where we're at, and for the quality of the programs like the Engage and Men on the Move, other programs that have been delivered, they're so underpinned by research that it has been a huge addition to where we're taking men's health.
Folks, we're coming into land, as I say. I see some people are still there on the screen. If anybody had a question or an observation, that would be grand. You'd be more than welcome, as I say, in our home. But if not, I just want to say again an acknowledgement to both of you for being here with us today for the Men's Development Network. Really, really appreciate it. As I say, when we were chatting and talking about what would it look like to bring different people in, there were certainly people that we wanted here. I see Fergal is online there as well. He's another man we wanted here today, and he's going to be with us as well later on. So it's just so wonderful you're here with us, that we've been so much part of the work together, and we just want to thank you for that, and we look forward to working with you in the future. So maybe to everybody there who came on today, thanks very, very much for joining us. This has been recorded and it will be available afterwards as well, as will a lot of, or indeed all of the other workshops and the materials from today. So we hope that will stand you in good stead. Any last words, Biddy or Paula, to say goodbye to us?
No, thanks for the opportunity, Larkin. And again, just to acknowledge the great work of MDM over the last 25 years and how delighted I was to be part of it.
Thank you very much, Biddy.
Yeah, I just want to echo that. I tend not to come off my holidays for anybody, but I really didn't want to let you guys down, because you've always been wonderful to work with, Larkin. So yeah, thanks a million for the invite.
Well, thank you very, very much, folks. Everybody go well, and Helena and all in the background for minding us and not disappearing us into cyberspace, which I could do with the press of a button. I'm glad we got through that workshop. So well done, everybody, and go well. Thank you very, very much.